Start with the hepatitis. What does hepa mean? Or hepat? Liver. What does itis mean? So hepatitis is a inflammation of the liver. You've got A, B, and C. There's a whole bunch more, but these are the big ones. Okay. You need to know how they're transmitted. Is there a vaccine? And the signs and symptoms should be very easy at this point because you already know what happens when the liver breaks, right? Okay. So hepatitis A, let's start with that one. This is fecal oral. So it comes out in your stool and then somehow you get it into your mouth. Okay. This used to be a big thing at daycares and restaurants, right? So if a person, your server, has hepatitis A, they go to the bathroom, they have a bowel movement, they don't wipe well, they don't wash their hands, and then they go and serve you food and you're eating their poopy hepatitis. Okay. But then it also turned sexual recently because people like certain weird sexual behaviors. And so it's oral fecal, if you get what I'm saying. Did you say you don't? Would you like me to draw you a picture? All right. So, okay, it is fecal oral. Do you understand that? All right, look at the signs and symptoms, okay? And tell me if these sound familiar. Fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, which will turn your poop clay colored because the bilirubin goes where? It'll go to the kidneys if the liver can't get rid of it. So without any pigment, your stool is going to turn clay colored and your urine will turn brown. Joint pain, jaundice. Do these sound familiar? Because your liver mad. Okay. How do you diagnose? There is a hepatitis panel. We're going to say that across the board. It's a blood panel that you use, and it will tell you which hepatitis that you have and whether it is active or whether it is inactive, or you have a chronic infection, or you have an infection you already got over. All right. So how do we treat hepatitis A? Well, it doesn't kill you, right? None of these symptoms killed you. You ever died from fever, fatigue, or joint pain? Okay. So we're just like, I'm sorry this happened to you. That is all. And in 6 to 8 weeks, you will be feeling better. That's all. Thank you. Do you understand? It's self-limiting. So symptomatic care is all you can do. Okay. Now, if this is a baby, okay, and the baby gets hepatitis, now that can be really harmful for a baby, obviously, because their livers are very immature, right? So we can give something called an HBIG. Anybody know what an HBIG is? Hepatitis B immunoglobulin. I guess I should have put hepatitis A, but the HBIG is considered an immunoglobulin. Okay, y'all know what an IG is? I know you haven't had immunity yet, so it is an IV that you can give. It's called IVIG. It is immunoglobulins you can actually give to help someone fight an active disease. Since this is a virus, hepatitis is a virus, we can't give antibiotics, right? And antivirals may or may not be effective because what do antivirals do? Do they kill a virus? No, they only prevent it from replicating. If it doesn't already replicated, then all I can do is give them IG, which is immunoglobulin that specifically knows to kill the hepatitis. You understand? Do you understand? Okay. Hepatitis A is not chronic. You can get over it in about 6 to 9 weeks. Is there a vaccine for it? Yes, y'all all had it. Okay. So what does a nursing care look like? We vaccinate children when they is just born. Like literally, they just came off the chute and we're like, boop, okay. And then you also vaccinate them at 2 months and 6 months. Okay. If a baby is born to a hepatitis B positive mom, because how is hepatitis A transmitted? Sorry, I meant to say hepatitis A. Hepatitis A, how's it transmitted? Fecal oral. And since a baby is coming out where there's, the holes are very close. Okay. So there is mixing of things. It is possible for that baby to get hepatitis. And remember, there's also mixing of blood. So hepatitis B can also be an issue as well. Okay. But if the baby, if mom has hepatitis A, we ought to treat the baby because, do you understand what I'm saying? Okay. Do I need to be more? You got this. All right. And then all we can do is symptomatic care, right? So we're going to make sure she's getting plenty of rest and having a very healthy diet, right? Avoid alcohol. So what do you know about alcohol? It's liver toxic. Alcohol is liver toxic. Okay. You need to watch medications for toxicity because the liver is not going to be working correctly, right? So it can't metabolize your meds. Good hand washing because it's transmitted fecal oral. Okay. Use separate linens. So like you shouldn't sleep in the same bed as somebody else because, you know, I don't know. Do you sleep in the new? I have no idea. I don't know what you're doing. You understand what I'm saying? You should avoid sexual activity, especially in the back door. Okay, but things, y'all get what I'm saying. Okay, so you should wait till that is resolved. Okay. Avoid preparing food for others while the infection is active because it is transmitted fecal oral. So if you didn't wash your hands well enough after you went to the bathroom and then you're serving food to others, You probably ought not. Do you understand hepatitis A? How's it transmitted? Fecal oral. Is there a vaccine? Yes. What's the treatment? Symptomatic care. What color is their poop? Clay. What color is your urine? Brown. Do you have a question?
So when it's like it's transmitted, so is it kind of like E. coli where we all have it?
No,
Or is it like
you don't have it at all.
has to have it?
Somebody has to have it to give it to you. Yes. Okay. All right. Let's go to hepatitis B. Your keywords for hepatitis B: blood, sex, drug, mom. What? Okay. Everyone. Blood, sex, drug, moms. Okay. So it is transmitted by blood. So if you have a blood transfusion, okay, or you're sharing like razors or things like that with people, from sexual activity because you're mixing a lot of fluids, drug use, especially IV drug use, yes, because you're sharing needles with other people, and then from mom to baby, okay, because now babies and mommies do not mix blood in utero. Y'all know this. But at birth, right at delivery, there's a huge influx of blood from mom to baby so that mom can give baby all her iron stores. Okay. But when that blood switches over, if she has hepatitis, she can also give baby the hepatitis. All right. How do you get hepatitis B? Blood, sex, drugs, mom. Got it? Okay. Look at the signs and symptoms. Tell me if this sounds familiar. Fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, clay-colored stools, joint pain, jaundice. But hepatitis B is chronic. So what happens when there is chronic inflammation of cells? You can end up getting cirrhosis and liver cancer. You with me? Okay. How do you diagnose? Already told you. Hepatitis panel, right? We can also do a liver biopsy just to make sure they're not already getting cancerous or cirrhotic. You with? Okay. There are some antivirals that we can give. Anytime something ends in VIR, that means it's an antiviral. Cool. Eventually, they may need a liver transplant because hepatitis B is chronic and you cannot get rid of it. Okay. There is a new drug out called interferon alpha. They like to test on that for some reason. I don't know why. It's dumb. Is there a vaccination for hepatitis B? Yes, there's now a combo for AB. Okay. And then if you look at your nursing care, a lot of it's going to be the same. Yes. Vaccinate, rest periods, fluid, nutrition, no alcohol, watch your meds, good hand washing. Do you understand? All right. Hepatitis C, keywords, blood, sex, drugs. What are your keywords for hepatitis C? Blood, sex, drugs. How do you get it? Blood, sex, drugs. Okay, look at the signs and symptoms. Fever, fatigue, loss of, you with me? They're the same, okay? This one can also lead to cirrhosis and liver cancer because hepatitis C is chronic. Is there a vaccination? No, they're working on one, I'm sure. You can do a hepatitis panel. You can also do a liver biopsy to see, are we already getting cirrhotic or do we already have liver cancer? You with? You can use antivirals. You can also use the interferon. Okay. Okay. And then this nursing care is going to be the same. What precautions do we go on for all hepatitis? Standard. It's just standard, right? Because it's either blood or poop. Now, what would you use if you were dealing with blood or poop? Standard precautions, which means wear gloves when you're coming into contact with a infected.
Do you not use contact with poop?
Huh?
Do you not use contact precautions?
You don't have to use contact precautions. You only have to use standard precautions, but yeah, you probably should add contact precautions only for hepatitis A, right? But for all of hepatitis, you really only have to do standard precautions. But you are right. If I'm dealing directly with their poop, then I would do contact precautions as well. Okay. Now there are 3 different stages of hepatitis. Okay. The first one is prodromal. Anytime in nursing school you hear prodromal, what does that mean? It means you feel bad, but you're not sick yet. You ever like, when you know you're getting sick, but you don't have symptoms yet, I just feel like run down. I feel crummy. I know I'm coming down with something. That's what prodromal means. It's like something's coming. So in the prodromal phase, you have very non-specific symptoms, right? Like fatigue, my muscles hurt, I don't feel hungry, right? My urine is kind of a weird color because I'm not drinking very much, right? Then they go into phase 2, which is the icterus phase. Icterus is when things are going bad. You have straight up symptom, all these symptoms that we talked about, and your jaundice. Because if somebody says that someone is icteric, that means that they are jaundice. So what's the icterus stage? Jaundice. So they have they're in the heat of it. They're itching and they have right upper quadrant pain because where is your liver? In the right upper quadrant. Then after they get through that, they go into the convalescent phase where that's like, you know how like you get the flu or something and then you don't have cough, congestion, muscle aches anymore, but you're like, I'm just still not 100% better. That's the convalescent stage. You with me? Do you understand hepatitis? That was easy.